Hi everybody, how do you diagnose for Hashimoto's disease? And why do you care about that? Well, if you're suffering from fatigue, you're tired, brain fog, you have thyroid type symptoms, Hashimoto's accounts for 80 to 90% of all hypothyroid patients. So most likely if you're having these symptoms and you've been diagnosed with hypothyroid, you probably have Hashimoto's disease. So let's talk about how we diagnose this. So before I get into this, I just want to tell you that even if you were diagnosed with Hashimoto's disease, traditional medicine doesn't treat it. I've had this discussion with many people we work with, and hoping that your doctor is going to try to change what they're going to do for you is you're going to be disappointed. The standard of care is thyroid hormone replacement only, and they do zero for your Hashimoto's disease, unfortunately. So that is just the reality. So let's talk about how we can actually diagnose it and what labs you're going to need. So there are two antibody markers we need to pull. Number one is going to be thyroid peroxidase antibody, or TPO, and the other one is going to be thyroglobulin antibody, or anti-thyroglobulin. Either one of those are positive, you have an immune system that's tagged your thyroid to be destroyed. Now, most doctors only pull TPO. So I've had a lot of clients that they have the TPO, they've told her they're normal, however, and they don't have Hashimoto's, but they never pulled the other marker. So they still don't know. You need to have both of them. Now, the other marker you do want to pull is TSH, thyroid stimulating hormone. This is what most doctors pull, this screening for a thyroid problem. And we do want that out of range for you to be officially diagnosed with Hashimoto's disease. Now, if you have high antibodies and you don't have a high TSH and you're still having symptoms, then you actually still probably have Hashimoto's disease, but you don't have enough tissue destruction to your thyroid for it to be officially diagnosed. Now, think of it this way. It's almost like you have termites in your house and your house hasn't collapsed yet. You've got the termites, but they're like, well, let's wait for your roof to cave in and then we'll do something, right? It just kind of doesn't make sense. And it's the same thing with this scenario. So if you have that going on, you have an autoimmune reaction thyroid. It's happening. You just got to wait a while to get an official label. But that's all the diagnosis is, as a label. We want to get to the root cause and find out how to put this into remission. Now, lastly, when you're looking at TPO antibody, for example, the reference ranges are different for almost every lab that you pull. So if you have LabCorp, pull your labs at 0 to 34. But Mayo Clinic and Quest Labs, their reference range is 0 to 9. So if you came back number at 22 and you had LabCorp pull it, they'd say you're negative, and Quest and Mayo Clinic would say you're positive. So if you're dealing with this stuff and you're tired of being sick and tired of not getting answers, schedule a discovery call. We can see if we can help you.